Picture this. You're on a busy critical care unit hanging a crucial IV antibiotic, insulin drip, and antiarrhythmic medication for a patient with a nasty infection and seriously ill. The IV site looks perfect. No swelling, no redness, no pain. You flush the line and it's smooth as butter. You hang the bag, set the pump, and move on. But hours later, your patient's fever isn't breaking. Heart rate and blood sugar remains elevated and their labs aren't improving. The doctor's asking, why are the medications not working? You check the IV again. Still looks perfect, flushes perfectly. You start to wonder, is it the wrong drug? Is the patient getting worse? Or is something else going on? This scenario happens every day. The IV looks fine, but the medication isn't working. We're trained to spot obvious IV failures, swelling, bruising, pain. But what if none of those are present? Sometimes the IV seems perfect, but the medication never reaches the bloodstream. The pump says infusion complete, but the dose may have gone nowhere. This is the hidden world of subtle IV failure, a clinical mystery that demands we look beyond the flush. So, what is a subtle IV failure? It's not the dramatic, obvious infiltration or blown vein. Instead, the IV flushes easily, looks fine, but doesn't deliver medication into the vein. The catheter might be slightly out of place or pressed against a valve. Saline gets through, but medication doesn't. Everyone thinks the drug is given, but the patient isn't getting better. It's like a blocked straw, where air like saline can pass through easily, but the milkshake-like medication, which is more dense, doesn't pass through. The system says all is well, but the therapy fails silently. These failures are dangerous because they're invisible. The patient misses critical treatment and no one suspects the IV. That's why subtle IV failures are so tricky and so important to catch. Why do these subtle IV failures happen? Sometimes the catheter tip is barely inside the vein, saline flushes in, but medication leaks out. Or the tip sits against a venous valve, a flush pushes through, but a slow infusion can't. A tiny fibrin sheath or microclot may form, letting saline pass but blocking medication. Sometimes medication infused at a low rate leaks slowly into tissue, not enough to cause swelling, but enough to prevent absorption. The result? The drug never reaches the bloodstream. No dramatic signs, just a patient who isn't improving. These hidden problems can turn a perfect IV into a silent failure. Understanding these causes helps us spot trouble before it harms our patients. Subtle IV failures are more common than we think and easy to miss. So how do you spot a subtle IV failure? The biggest clue: therapeutic failure. If the medication isn't working, failing to see expected results, question the IV. Don't just blame the drug or the patient. Ask, is the medication actually getting in? Listen to your IV pump. Frequent occlusion alarms or pressure alerts can signal trouble. Don't ignore alarms. Investigate them. Use your hands. Palpate above and around the site for coolness, firmness, or subtle swelling. Compare both arms for differences. Check for blood return. If you can't get any, be suspicious. And always listen to your patient. If they say it feels weird or different, take it seriously. Trust your assessment skills and intuition. They're your best tools. Suspect a subtle IV failure? Act fast. Stop the infusion immediately. Don't just turn it down, clamp the line. This prevents more medication from leaking or being wasted. Remove the dressing and thoroughly assess the site. Look, palpate, compare both arms. Try for blood return. If none, that's another clue. For critical meds, don't waste time. Start a new IV in a different location. For less urgent meds, you can troubleshoot, but a new line is safest. Document everything: your findings, actions, and patient response. Share your experience with your team. Awareness helps everyone catch these failures sooner. The faster you act, the better for your patient. Don't let a perfect IV fool you. At the end of the day, great nursing is about clinical judgment. A flush can lie. A perfect flush doesn't guarantee a working IV. Your intuition is a powerful tool, built from experience and pattern recognition. If your gut says something's wrong, listen. Look beyond the flush, assess the patient, connect the dots, and question the obvious. Don't be afraid to advocate for your patient. Our job is to ensure the medication works, not just that it's given. Be the nurse who investigates, who trusts their skills and instincts. Because when it comes to patient safety, your gut is often your best guide. Thank you for watching and supporting my channel.